Okay. Not on my computer, but I'm sure the public can hear me. You guys are good? Thumbs up by Blaze and Chris. All right, good. Chris McKenna, we're good? Okay. All right, good evening, Orange County residents. This is a unique press event. We're trying to get the word out on the coronavirus. I'm your County Executive, Steve Neuhaus. We have the Times-Hour Record with Chris McKenna, Mid-Hudson News with Hank Gross, and we have News 12 with Blaze Gomez, all streaming this live on Facebook. I am going to give the volume down on my computer here. Give everybody a quick update. This is what I give to the town supervisors and mayors when we do our conference call every day. Where we are today, March 19th at 6 p.m. in Orange County. So right now we still have 68 people that have tested positive for the coronavirus. We have a total of 10 people that are hospitalized. We have as available beds for people that need to be hospitalized, 40% in Orange County. And thousands of tests are outstanding. This testing has taken longer than we obviously would like. Some people are waiting many days for that. So I'm going to go into it. Some of the questions that came through from people: utilities, Orange and Rockland, NYSEG, as well as Central Hudson, are not shutting off power. Been very cooperative with us. Supermarkets are down to 12 to 24 hours behind. Paper and bottled water, paper being toilet paper and some of those products, should be in by the weekend. If you have incidents of price gouging, give us a call, 845-360-6700. We had a total of, I think, 3 violations today. We had a number yesterday. We've been sharing that with the media, sharing that on Facebook, so people know who has violated that law. We also have homeless shelters and warming centers we're working on. If they want to talk about that even in more detail, we'll address that later. We have a helpline. This is a critical line. So if you've been laid off and you're wondering about where you're going to get your food, where you can get a prescription drug filled for a senior citizen, people that have any type of issue, we have an Orange County 1-800 helpline. It's 800-832-1200. We're going to have all the stuff is posted on orangecountyGov.com, the county execs page, the health department page. The businesses, for small businesses that are out there, it is a little frustrating. I talked a little bit with one of the reporters before we went online. There's a number of businesses that are being impacted by this, ones that have been forced to close or are closing. There is a number to call from New York State to get yourself registered as being impacted by this. That's 845-802-9150. If you have to wait online or you have to leave a message, do it. Just get yourself registered in there. Orange County itself has a number. Bill Fioravanti, our Director of Economic Development, 845-360-0231. Again, this number's online. He will call you back personally, or Steve Knob from our Jobs Department, to try to walk you through the process. There's a lot of unknowns, but we are going to help you out as best we can and facilitate that contact between the state and federal relief that's been promised to come our way. Emergency orders. Yesterday, the governor decided that no more emergency orders from local government. That means towns, villages, cities, and counties. He's trying to keep them streamlined. So any future and further changes and cancellations for schools or other things have been postponed. I'll just hit the 800-pound gorilla in the room, and then I'm going to go to Commissioner Casey and Commissioner Gelman, Dr. Gelman. Yesterday, a medical doctor from the village of Kirschwell, town of Palm Tree community, released a video saying that a number of the residents have tested positive for the coronavirus, and he expects upwards of 90% of that community to be infected with the virus. A number of the community has tested positive, but being that video went out and that man is a medical doctor that does treat people in that community, I have asked the governor to consider creating a containment zone in the town of Palm Tree, Kirschwell area, which would facilitate extra resources, and including a testing area there to try to put a lid on the spread of this virus. That has been done in New Rochelle. That's been done in other areas of the state. The hospitals in Orange County are doing okay. I told you earlier that the beds available are 40%, but they are very concerned to have a major outbreak in one spike or in one area. So that's why it's critical that the governor of New York State creates that containment area so we could try to stop the spread of that. With that, I'm going to go to Dr. Gelman, ladies first. Then we'll go to Commissioner Casey, and then we're going to hear from the reporters and from the people themselves.
Thank you, County Executive Neuhaus. As Mr. Neuhaus has mentioned, we have 68 confirmed cases. 10 of those are hospitalized, 2 are in critical condition. We are currently following over 150 mandatory quarantine cases and over 300 voluntary isolation cases within the community. Clearly, we have community-acquired transmission, with that the underlying assumption being that anybody in the community, including yourself, may potentially have COVID-19, hence the need for the necessary precautions and correlating actions. To the greatest extent possible, please remain home. Postpone or reschedule any non-essential medical services, non-essential procedures, any sort of elective surgeries or wellness visits. First of all, as a risk mitigating strategy to both protect yourself and others, as well as medical staff, and also as a means to conserve the necessary PPE and supplies. The Anthony Wayne testing site, the drive-through testing site that is staffed by the New York State Department of Health, is operational. It is by appointment only. That number is 888-364-3065. It also happens to be the 24-hour hotline where the New York State Department of Health can answer any and all questions. I did recently come across a number of interesting research articles and sort of emerging evidence-based papers. The World Health Organization has expressed concerns regarding the use of ibuprofen for the reduction of fever in patients that have tested positive for COVID-19. Of course, speak with your medical doctor before changing any routines, but the World Health Organization cautions residents in the use of ibuprofen as a fever reducer. In terms of other medications, there have been some interesting literature with regard to blood pressure as being one of the comorbidities that had the highest degree of correlation with complications associated with COVID-19, and that rate of complication tends to sort of reside in that 16% range. And that's interesting to see, with hypertension really topping the charts. Typically, we're used to cardiovascular disease or diabetes. With that said, some of the articles also stratify the data, and they insist on the fact that it's more the medications that are used, and those are ACE inhibitors and angiotensin receptors blockers specifically to treat hypertension. So that's an interesting fact to discuss with your practitioner. As far as the silver lining, vaccine trials have begun. As all of us have heard, the first cohort have received vaccines. It's going to be a long road with vaccination in general. And also within that same vein, studies and clinical trials have begun on 2 medications. One is hydroxychloroquine and the other one remdesivir. And typically clinical trials with medication, or at least the use of existing medication and new applications, tend to take a little faster and get to market a little faster than vaccines. With that, I hand it over to Commissioner Casey.
All right, thanks, Doc. Overall, emergency operations are going well. We've had a great deal of cooperation amongst the emergency services, our elected officials. Everybody's really pitching in. 911's been quiet, which is good. Means people are behaving, which we always like to see. Our supplies are trickling in. We get small deliveries every day here at the Emergency Services Center. We fill orders for municipalities and police departments, fire, EMS, some medical facilities. We're supplying them with the equipment and supplies also. The one thing I would ask is we have had some reports of bars and/or restaurants not in compliance with the full closure order for having people inside consuming alcohol or eating. Please try to comply with that. It's for your own good, and it places the police departments in a difficult position there trying to enforce that law. We also have a helpline for the county, 1-800-832-1200. And that's sort of a catch-all for any issues you may have with food issues or homelessness, or it's eventually going to be our 311 line once we get that up and running, but that is also available for your use.
Okay, we were asked right before we went online some of the concerns. We have three main concerns, but everything in between. One is people's health, people that are sick now or people that are trying to not get sick. Number two, we're concerned about the many thousands of residents in Orange County that have now recently been laid off. Some of them getting paid by their employers, some of them being told to go on unemployment. So our immediate concern on that is working with your school districts and your towns, cities, and villages to make sure that you have food and prescription drugs. So we've expanded our senior dining program as well as the veterans food program and the backpack snack attack that we do with schools to try to offer it to anybody who asks for food at this time. So that is going well. If you have any issues with that, you call that 1-800-832-1200. The final thing is to help small businesses. We set up a task force with the Orange County Chamber of Commerce, our economic development team in Orange County, to make sure that we can provide any relief as that comes down to businesses that have been impacted, forced to close or on limited hours. And on that note, on a regular basis, including tonight, we have ordered food or taking out food as best as possible to support our local community. So we have pizza coming in tonight. Last night we had Chester's, Andrew's Deli, and the day before that was Delancey. So on a regular basis, we are practicing what we preach. We encourage you to do the same thing, buy gift certificates, buy takeout, and continue to help those that are still open. With that, we're going to turn it over. Blaze, ladies first. We'll take some questions from you, and then we'll go down the line.
Thank you so much. Can you describe in depth what this containment zone in KJ would potentially look like, and whether or not there would be any consequences for violating any state ordinances or laws as a result of COVID-19?
Okay, so it wouldn't look like those apocalyptic stories that have been on, or movies on TV every night. What it would look like is the state would come in, shut down every business for the most part. Try to what the goal is to prevent people from really leaving, and we've talked with some of the community members, open up other locations where you can have people self-quarantine or isolate. That community in general is a very dense community, large families, tight gatherings. So that would be to try to give them the space to try to prevent it from spreading to other people. It would also open up medical treatment as well as medical testing options there. So you don't see a police state in New Rochelle. What you see is an area that's trying to prevent people from coming in, prevent people from really going out, preventing businesses from operating where people can congregate, and so on and so forth.
Thank you.
Any other? I'll go to Hank. I don't see you, but I'll go to you, and then Chris.
My camera's not working tonight. I apologize. I realize that we need to do what we're doing, but this is going to change the face of business and life in the United States going forward. I would imagine that many small businesses may not survive, and you're liable to see some of the smaller airlines go under, and just in general, the economy is going to suffer from this. Would you agree?
Absolutely. We're already seeing a major impact with so many people unemployed, many businesses. I'm on Facebook a lot, and I'm getting urgent requests from businesses as well as individuals for help. And there's a lot of unknowns out there, but the one I think that's a silver lining in this is we're all in this together. This isn't an Orange County issue. This isn't a New York State issue. It's a U.S. global issue. So I think you're going to see some major stimulus packages coming down to try to keep people afloat. The fact that you have utilities giving people a break, not shutting things off, the paychecks for unemployment being waived, that 7-day grace period is now waived. So you can try to get that relief instantly to people. So if that works and you're able to get employees a check in their hand within a week from now, and at the same time provide those families with critical items like food and water and prescription drugs, and their power not being shut off, that may be able to give us the buffer to at least balance some of the blow. We're going to lose some businesses, unfortunately, but we could try to retain as many as possible.
Doc, at what point do you anticipate this situation peaking? I know I've heard 2 weeks, I've heard 2 months.
Doc?
I think a safe estimate is about 4 to 8 weeks.
If I may speak and ask another question, Dr. Gelman, if you can you clarify what other municipalities are currently, dealing with COVID-19 here in Orange County? I know we've said Monroe for one of the first cases. We've now confirmed KJ. What other municipalities have residents with positive cases?
So right now it's safe to say that we have broad community acquired transmission. So almost every municipality has either a confirmed positive case or a direct contact of a confirmed positive case where they are under mandatory quarantine.
Are we seeing any cases that are affecting otherwise healthy younger people, children, or is this only immunocompromised and elderly residents?
We have not seen pediatric cases thus far. We have had single-digit accounts of individuals that are younger. Majority of the individuals do fit the typical criteria that you would expect for susceptible and vulnerable individuals.
And the 10 hospitalized, 2 in critical condition, are they elderly, immunocompromised?
They fit that general description.
I'm going to go to Chris McKenna. Chris, from the Times Star Record.
Is the percentage of available hospital beds, is it 30% or 40%?
40% right now.
Okay.
We keep a tab on that every day.
Have any hospital workers or medical office workers gotten coronavirus?
Have they
Tested positive.
Have they tested positive? There have been some medical workers that have tested positive. Not all of them were Orange County residents, but yes, there have been positive, and they were identified and they were under mandatory quarantine.
I'm just, while you guys are regrouping for some questions, I got some text messages from people. Our hair salons and barbershops, doctor, what's their prognosis? I know that, Brendan Casey just got his haircut today.
There was the last one to get it.
I think that was the last call. I think he did get into the
Are
last
they
call.
going to be closing? Or?
As per the governor's order, I believe the last issued order, they were ordered to be closed.
Okay. So the governor's office, by the way, for anybody listening, there's a lot of confusion of what the laws mean and details on it. We were told by the governor's office today that online on the state site, and if there is, we'll show a link to it on the county site, they'll be having more details and explanations of what that 50%, what the 70% reduction in workforce is in the private sector mean. So with that, we'll go back to Blaise Gomez. Or Hank. Blaise, you want to yield to?
I do have another question, but Hank, you can go ahead, and then maybe if we can circle back to me.
Yep.
Sure, thank you. When you first had St. Luke's on the other night, it was mentioned, I think, 26 employees had come in contact and were being tested and were furloughed for the time being. Did any of those folks test positive?
So, again, I can't comment on the diagnoses. They did not test positive, and majority of them were returned back to work. And that's not just the case for the St. Luke's employees, but initially, and that's precisely why we don't typically report out the numbers as soon as they come out, because there are criteria, CDC set criteria for specifically healthcare workers post-exposure. It's a staggered criteria depending on the proximity to the positive case, the duration of treatment, the amount of PPE worn, and that's a very lengthy process. That's why initially you tend to get a very high number of healthcare workers as we do our line tracing and contact investigation. But as it winds down, a large proportion of those healthcare workers return back to work.
Blaise, you had a question?
Yes, what's the county's current protocol for COVID-19 testing? I'm getting a lot of messages from residents saying that they've gone to various testing centers and are unable to get either themselves or their children tested.
And it's
So
not the county's
right,
protocol.
I just wanted
Yeah.
to clarify that point. So that's not the county's protocol for testing. The individual has to be symptomatic and or meet criteria as set forth by the CDC and the State Department of Health for a PUI, a person under investigation for COVID-19. Each facility and each provider has their own algorithm and their own protocol that they follow for testing, but all providers adhere to that criteria, and that is broadly available online.
Doctor,
While we have you here, can you kind of, generally clarify what that is?
So, and again, that changes as well. It has to be an individual that's symptomatic, that has a high index of suspicion for COVID-19, where they were either directly exposed to a COVID-19 patient or they live in close proximity to a COVID-19 patient. So they're quite specific criteria. And I will say that much, just because we're entitled to be tested and we want to get tested, it may not be the best idea. The general public seems to really kind of really flock to the fact that we need to get tested as soon as possible. However, that does provide a false sense of security where you may essentially have a false negative. Just because you were tested for COVID-19, if you did not meet clinical criteria, that does not rule out COVID-19. You would have to have a clinical criteria met. So it's sort of a dangerous scenario. Plus, it's exacerbated by the fact that you may have a otherwise healthy individual with an upper respiratory illness presenting to a facility, possibly in close proximity to a COVID positive patient, where they're exposing themselves to COVID-19, or the reciprocal may hold true, where an individual is COVID-19 positive, they're presenting to a facility and may potentially expose others. So that's why the best policy, as I mentioned before, is stay home. Even if you're symptomatic, stay home, because if it is the flu, you follow the regular treatment protocol that you would for flu-like symptoms. And if it's not the flu, the treatment protocols do not change. There are no pharmaceutical interventions at this point. So the best way to approach this is to just stay home. If you're critically ill, dial your provider, and if you're having an emergency, call 911.
Doc, can your pet or livestock animals, can they get it? Can they give it to you?
Yes, so this
That
is a
came in
frequent.
online. I'm looking
Yes,
at online.
and that's a
questions, too.
frequently asked question because the CDC has initially released the fact that even though animals and specifically domesticated pets can test positive for COVID-19 because they have a very low viral load, they don't necessarily transmit. However, I will say there are preliminary accounts specifically out of Hong Kong, and again, these are singular digit anecdotal accounts, but I will caution, this virus initially had zoonotic transmission. Just harken back to how it all began. It began with zoonotic transmission from an animal to a human. Reciprocal transmission is possible, and any animal can act as a vector. So there is an account of a dog. As a matter of fact, I believe that dog passed away. It was a 17-year-old Pomeranian, as it happens to be, from possibly old age, but also testing positive for COVID-19. So the protocol actually, despite the fact that the CDC sort of denies the fact that pets can transmit COVID-19, but they do test positive. So the protocol dictates that your pets in home will be quarantined along with you because of that possibility. So that's kind of the distinct answer for that.
Chris McKenna?
You mentioned the workforce reduction right now. Is the order that was issued today about sending home 75% of the workforce, does that apply to governments? And if so, do you exempt from your numbers the essential employees like Valley View and the jail, the corrections?
It's a tough order. Both the private order and the public order are very tough. We do a conference call every day with every mayor and supervisor in the county, and some of these communities, the police department is over half their employees, so they can't go to below 50%. So that's on the government level. And the same thing with ours. Like, we've sent some departments on a liberal leave home because we don't need them, but other departments like Valley View, Department of Health, Emergency Management, we're trying to rotate shifts. We segregated the county into 3 silos. I'm at the 911 center with an entire team with me. Harry Porter, Deputy County Executive, is at the Government Center with another group of employees. And Dan Bloomer, the Director of Operations, is at the Fire Training Center. So if one of us or one group gets sick, we have that backup. We've had that with many other departments, but we have given the guidance to the local communities to do their best, but their obligation is to meet their community needs. And if that doesn't comply with the governor's order, we can go back and explain to them why. Look, 60% of my workforce is police officers. I can't go to the 50. Now, the private sector has asked us for help on it. We've helped them. Some companies make certain products in Orange County. We're trying to keep them open. The more people that close, the more that adds to the unemployment rolls and the pressure for food and things like that. So and obviously also increases the risk of businesses going under. So that's pretty much where we stand on that, Chris.
But does the county have to get down to 25%, or does that
No.
apply only to private business?
Only to private. We have to get down to 50% as well as other governments. That's the rule of thumb.
Okay, two questions for Brendan. You mentioned that some bars and maybe you said restaurants as well have not closed. Is there any penalty for that? Is there any enforcement mechanism?
There is. I mean, there's two schools of thought on it. There is a penal law section, criminal nuisance second, which I think fits. But there's also a violation of the executive law, which some of the attorneys had advised that the local municipality would have to pass an emergency declaration mirroring the governor's declaration in order to make that enforceable, which the governor now has said, I don't want that done. So there are some remedies there. The district attorney has an opinion. The judges have an opinion. The county attorney has an opinion. I would. The police departments generally have a pretty good relationship with their business community, and our advice is to visit the site and kind of tell the owner, hey, come on, this is no good here. We're going to take action if you don't address this. And then, I would probably charge the penal law section and then have them hash it out in court.
And we've seen it happen, Chris, and it's been successful. Our calls with the towns and villages and cities is if they don't comply and you have a further problem, then get back to us. But the ones that brought it up, they've had visits from their local law enforcement, and the issue's been resolved.
Okay. The other question was, Brennan, do all first responders now have masks?
Yeah, I believe that every department has proper PPE at this point. We've been filling orders every day, so that's my understanding. Is it's out there in every single department now.
Okay.
Somebody asked a question about supermarket special hours for seniors. They're from store to store. So if it's your ShopRite in Chester or your Price Chopper here or your DeChico's in Cornwall, each one has specified hours specifically. I'm going to go back to Blaze and then Hank and then back down to Chris.
Steve, are we thinking about possibly minimizing some of the workforce or the departments within the county, specifically, early intervention? These workers are going, into individual homes. Some people are asking me about other departments like DPW.
Yep.
Can we switch to sanitation, perhaps as essential workers only, and get rid of some DPW crews? What are your thoughts?
So some of those programs are critical, but they have changed. Early intervention, unfortunately, you were trying to minimize impact. The same thing, even things like Meals on Wheels. We used to make sure that they go in and check to make sure the seniors are doing well. Now we're basically knocking the door. They answer and leaving the food almost like a knock and run. Because we don't want to impact and exchange any of those viruses. Even probation, we're looking at doing a video calling as well as phone call system just to get through this. Obviously, we're handling each case differently. But and now you talk to the regular workforce. I'm trying to keep some staff home in reserve because I'm worried about the burnout factor. Some of you guys asked when we're going to meet the peak. We had 370 people or 470 people die in Italy yesterday, 420 today. Those are major numbers, and they still say we're weeks and weeks behind Italy. So the more we get people to comply with not going out and if you're feeling ill and washing your hands and doing all those things, I need to be prepared for the worst as the county executive. So as well as many of those are going home, I need those workforce. People are calling us for help. the desperate messages, you got to see these things. I'm calling that 1-800 number. I desperately need help. I'm a single mom. I don't have money for food. So these are critical things that I think only the county can fill until the state and federal government can get worked up. So,
do we
Hank?
have enough,
Yep.
do we have enough beds available in places like for homeless folks? Because I suspect you're going to see a rise in homelessness. And on the same note, as people get more and more destitute and stressed out over this, unfortunately, you're liable to see a rise in the suicide rate.
Yeah, we have so that 1-800 number I gave you that gave out 1-800-832-1200, they will help you with anything. So if you're looking for help for food or something like that, or if you have any depression issues or somebody has an addiction issue, they're going to point you right in that direction and get you help. Going to the homeless. For the most of the part, we have put our homeless shelters on lockdown. We don't want people coming in there and impacting those families. So the other thing, the issue of today is warming centers. Warming centers, based on the governor's decree to not have people gathering, have been starting to talk about closing or have closed. So what do you do with those folks in there? If they qualify for housing, we will get them into a hotel or some type of place and get them a bed and place to be. If they don't qualify, meaning that they have a house to live in or they don't want to live there, those are going to be addressed in a different area. We also have a special group for runaway kids, so to say, a place, so those are the type of things. I don't want to get into the details on it, but we are very concerned about those, Hank. Great questions. Chris McKenna?
Do you know if the state wants to use the former Horton Hospital for surge capacity? And are there any other sites under consideration in the county?
We've talked about Horton. It's not something I think that's going to happen for ORMC. I'm very close with Scott Patoulis, the president there. They are looking at alternative areas and sites, as well as St. Luke's. It's what we're supposed to be doing together. I do not know if Horton's going to happen. You also have the former Cornwall campus that could happen for spillover. That might be plausible because they just recently closed. I'm not going to answer for St. Luke's or ORMC, but we have an active dialogue daily on where we're going to put the extra people when we get them.
Would that be the initiative of the individual hospitals? They would be there.
Yes.
It would be on them to
yes.
find additional beds.
With our support and obviously the blessing from the New York State Department of Health.
Okay.
We talked about temporary hospitals possibly opening up in KJ. Are there any other municipalities that we're now considering opening up these temporary hospitals in the county?
I mean, the three main hospitals we're dealing with are Bon Secours, St. Luke's, and ORMC. Like we talked about a little bit earlier, we're at 40% available space. They are addressing those issues now. They are looking at it, and it'll be under their leadership, but nothing to have a standalone, like some type of an emergency center, as we talked about earlier, in the village of Kirstorel, town of Palm Tree. So no, random place in another town.
What are the hospitals normally at? You mentioned that we're now at a 40%, vacancy, so to speak. What are they at normally?
Doc, I mean, right, well, if we only have 10 people hospitalized from this right now, so I would...
The rest is normal capacity.
The rest is normal.
Right.
We start going to 20 and 10%, we're going to be making some drastic things. And the state knows this. We're reporting this up to them, but they have critical issues all over the state, not just Orange County. That's why you have a hospital ship steaming to New York City Harbor.
And on that note, Steve, I heard from one of my colleagues that they saw on CNN today that ship is not on the way because it's dry dock, well, it's being repaired right now.
I'm surprised that they could stand up two hospital ships at the same time right now. But look, again, we're all in this together. And, I talked to Sullivan County, their manager, and I talked to the county executives from both counties, Ulster and Dutchess. as well as my colleagues around the state. I mean, we had a conference call with George Latimer in Westchester, who has the most cases, I think, right now in New York, along with the mayor of New York City. So people will get care and they will be prioritized. But these are the conversations that are happening right now in your local hospitals, the state, and here in Orange County. Chris?
I'm good.
Okay. Back to you, Blaze.
Same here. I think we're okay.
Hank, you have any alibis?
Yeah, one quick question. We mentioned hair salons and barber shops have to close. What about nail salons for the women?
As well. They're included in that.
Okay.
They are, okay.
There's some good questions coming on here. I mean, we've been on for a half hour. I'd like to stay for a couple more minutes. So one question, Dr. Gelman, and if the media needs to bang out, you guys can stay on or whatever. But somebody says, if Horton is off the table, why not use some of the hotels for spillover? Is that an option?
I mean, we're entertaining all options. We have quite a number of contingency plans in play. Ultimately, we're going to see what the surge capacity looks like, and that's where we're going to go.
People say, can we stop the fear mongering? I mean, this is something that we all think. I mean, Dr. Gelman, myself, and Brendan Casey are not new to this. We all know we're going to get through this. If certain things, if you act and listen to some of the warnings from the professionals, wash your hands, avoid people that are sick. If you're sick, stay home. Close your business if you can. We will get through this a lot easier. But we have no doubt, the three of us, we talk about this every day, that this is something that we're going to get through.
I mean, it has a high survivability rate. It really is that those people with underlying conditions. The issue is if you're a healthy person, you could transmit it to someone who's not as healthy. But, that's what the social distancing is all about, and making sure that even when you are dealing with people, you should be 6 feet away from them. So, we'll get through this thing. It's just going to take us, I say a month, Doc says 2 months. So we'll see what happens.
Well, I think it's sort of the average of the two answers, and I completely agree with both of you. And we typically field a lot of questions about what the new orders for closure, what they include, and I know they tend to change with every day. And frankly, I believe these types of inquiries seem to miss the entire point, where the more aggressive the disease containment measures up front, we really need people to stay home now in order to avoid that complication rate that we were talking about of 16%. This is a flu-like illness, so it has flu-like transmission. And in order to decrease the propagation of disease within our community, we really need kind of everyone to take aggressive measures now in terms of staying home. With that said, it has a higher rate of complications than the flu, so that's 16% complication rate of the total disease burden in the population. That's what we're concerned about, because not only is it higher than the flu, it also takes place over a shorter period of time, where a flu season is really stretched out over a longer period of time. Here you will experience that same wave, and it may be even the same amount of persons or even more people having the flu and presenting to the hospital. However, this happens in a very short amount of time. Because it's condensed, you experience that initial tidal wave. And that's really what the priority is with this and what we're trying to avoid. And the fatality rate, as you've mentioned, yes.
Hank Gross talked about how this is going to change a lot of things in our system. Some people ask, why are places like social services open? Frankly, because people need help.
Absolutely.
A third of the population in this country is on Medicaid, and that's for people that are poor, disabled, or some of the elderly. Those individuals need help. So we might not have the door open, but there'll be a phone number there. There'll be a staff person to get back to you. You have that number for emergency hotline in the county for health that after 5 p.m. it goes to a call system where a nurse will call you back.
Yes, and
there is still very critical services that need to be done, and now probably more than ever because so many avenues are shut down in the private sector.
And it's always a risk-benefit analysis with any procedure, with any surgery, with anything we do in life. It's a risk-benefit analysis.
I got a ton of questions about school. Look, I shut the schools down earlier last week. People thought Orange County was too forward-leaning, and then all the county execs were calling me saying, what are you guys doing? How can you close the parade? And then it just progressively around the country. That night, the president came on and said, stop international travel. So working with the school districts, we have a number of them in Orange County, I decided to close them under the advice of Dr. Gelman. We were intending tomorrow to shut them down for another 2 weeks. That now that the governor has pulled back the ability of doing those emergency declaration orders, we anticipate ballpark. Dr. Gelman, you have young children in the school districts. I have young children in the school districts. We think that they're going to be closed at least for another 4 weeks, possibly for the rest of the season. So any advice besides that out there? Because the order is going to come down from the governor, but I will tell you the school districts, in my opinion, we're on board with me closing for a total of 4 weeks. And that would have been done tomorrow, but now the governor took that ability away from me, folks.
So we'll really see how the disease progresses and what the actual disease burden to the community looks like. But ultimately, I have to re-emphasize the fact that the real underlying purpose of this is that social distancing component, and that's meant as a prevention strategy in order to curb the community-acquired rate. So if we can get that rate of propagation down early enough, we can avoid a lot of the consequences that we're discussing. And of course, it's difficult. Yes, having multiple children at home myself, it's a difficult prospect. But I truly urge you not to treat this as another snow day and as an opportunity to congregate elsewhere because school is closed, because the real point here is that social distancing measure in order to avoid the high rate of propagation within our community.
I mean, I keep going back to Italy as the worst case scenario, and as the county executive, a military guy, a state trooper of 30 years, a zone commander, as well as a health commissioner, we need to prepare for the worst. We're not preparing for the apocalypse, but that's why people are saying, oh my God, I can't believe it's going to be that long. Some questions out there. Volunteers. Local towns have already started putting together lists of people to help with backpack programs, delivering Meals on Wheels. There is a need out there, and I got to tell you, America is at its best at the worst of times. It is literally shown throughout our history in many occasions. This is one of those times, and we're seeing it. We're seeing tons of people stepping up, helping people. So we do need volunteers to get things out of there. I would ask you to contact your local towns or cities or villages if you could. We will let you know as well. We will put that information on the websites. Like I told you, those Meals on Wheels programs that we have now, 1,000 seniors getting a meal at night, 200 different veterans families in Orange County, thousands of schools providing meals right now, is only going to be expanded, at least for the near future, as people become laid off and or unsure when those unemployment checks start actually arriving in mailboxes. So your opportunity to help is here now, and it'll only grow in the future. People are asking about other nursing homes. Valley View, we're obviously very intimately involved with it, keeping them safe and quarantined. But other nursing homes have reached out to us today on finding auxiliary additional nursing help. And we started identified people that have retired in the last 5 years in the healthcare industry to maybe come in and augment that. We've watched other examples around this country. Seattle, where the nursing home of 90 people, 19 people died in that nursing home. Their whole staff wiped out. Other outside health agencies had to staff those nursing homes. We're already looking into that. These are the type of things we need to think about, as well as the people on the other end of that camera. What type of other things haven't I thought of? So other questions, Dr. Gelman, has there been a determination on how long the virus lives on surfaces? We've seen all sorts of stuff on there. A day, 2 days, 1 hour.
So it's definitely varied opinion, but thankfully, as far as the food containers and food specifically, the U.S. Food and Drug Administration, as of yesterday, came out with their recommendations, and they are stating, the U.S. Food and Drug Administration, that there is no evidence of food or food packaging being associated with transmission of COVID-19, and they have posted the series of questions and answers that are specific to that question. So I urge you to visit the U.S. Food and Drug Administration for that Q&A. It's quite useful.
Just one part of that. I know you're referring everybody there. I'm talking about curbside deliveries. We got a pizza waiting in the other room for us.
I'm eating it.
Are you? What is the risk on that?
Minimal to none.
Okay, good. Dr. Gelman, another one for you. Do you know if there are still elective surgeries being done in hospitals?
So we have had the conversation with every single provider in Orange County. I personally spoke with every single major and middle provider in Orange County, and to the best of my knowledge, as of this morning, there are no non-essential elective procedures currently performed in Orange County.
I got back. This is the question that every night I do a quick update, 3, 4, 5 minutes. I probably do another one just to give people that haven't been logged on to this and don't have an hour to listen to this here an update. But every day I get the same question about daycare centers. Why haven't they been shut down? The governor has the authority to shut them down. I will tell you the reason why they are not being shut down now is because first responders, healthcare workers are relying on those to watch their children. When you start closing daycare centers, firefighters, cops, nurses, doctors have to now make other plans or stay home. So what I've been advising people is start calling, making plans if that does happen. If you're using a daycare center, fine. We want to try to keep those businesses open, but we can all anticipate if things get worse, those could be forced to close. If they're forced to close, you're going to have to call your in-laws, your neighbors, your friends, anybody else, or you'd have to make that drastic decision of staying home when you're probably a critical employee. I'm going to keep it open for another 5 minutes, take some more questions. Let's see here. A lot of people ask about daycare again. A lot of people are talking about early intervention. Telehealth, doctor. When will telehealth be 100% in the county?
So telehealth,
Providers.
we are most definitely working on that specifically to incorporate the available systems already within hours. And I have the first demo for our app that's specific to COVID-19. So I was glad to see that this morning. So it's coming.
I talked earlier about the supermarkets restocking their shelves. The only problem with the supply chain now is that people are buying 6 years worth of toilet paper. And what is being done about hoarding is some of the questions here. Many of the stores are now starting to put security guards or limits on how much water, bottled water, or toilet paper you can buy. I am being told by the supermarkets that this weekend they should be fully stocked up. Again, we're asking the public to not buy 6 years worth of toilet paper or that much worth of bottled water. Buy what you need. The stores are restocking them. I would tell you otherwise. So produce, they said, is pretty much online, back online. The other stuff is about 12 to 24 hours behind. That's beef and things like that. Again, people are buying much, much more than they need. Once that starts stabling out, and now the people that did buy 6 years worth of toilet paper don't need to buy anymore, those numbers are going to start getting caught up and you'll be back to at least relatively normal.
Steve, may I ask you a question?
Yes, Hank.
If just a fraction of the folks in the village of Curious Joel do test positive and get the virus, New York State could become the love canal for the whole country in terms of this virus.
Well, that's the case in any densely populated area, whether it's in our community or anywhere else. And it's not necessarily specific to the subset of the community that you're mentioning.
People keep asking me what stores, what barbershops, who's open. I would call before I go to any of these places.
Yeah.
Call before, some of the supermarkets, it's tough call. They want to do an hour for senior citizens. But if you have moms that are a single mom and they finally got the babysitter or their neighbor to watch their kids and they show up there and they only have a half hour, I don't know if they're going to get turned away. So I would call before you go to any of these places. Drive-through testing in Orange County. We have a drive-through testing up right on the border of Rockland. That is open to Anthony Wayne, but that is one that you have to call ahead of time. If you want to call that number, that's the state number, 888-364-3065. It's the Anthony Wayne testing area. There is no plans for a drive-through in Orange County now. It all relies on resources. We are ready to stand one up if we need to, but you need supplies. You need test kits. You need people. So all that stuff has to come online, and it's all driven by the state. So I am going to probably the quarantine period, Doc, just real quick for people if they thought they had it. It's a 2-week
14.
14
Right.
days?
So if they're exposed to a confirmed positive case, it is 14 days mandatory quarantine period. Yes.
Okay. I'm going to probably cut it off now because I got a lot of people saying, hey, what's up, or talking, saying hello to each other. So I thank everybody for being here tonight. I want to thank News 12, the Times Hall Record, and Mid-Hudson News for all doing this tonight. We're trying to share this as much as possible with you. And we do teletown halls. I do a daily message to tell you guys where things are, the latest numbers, and anything pertinent to you. So if there's something that we didn't answer, message us on my page, and one of my staff or myself will get back to you. So thanks for joining us, folks. Have a great night.
All right,
Thank
thank
you.
you.
Thank you, guys.
Thank you.